Jen. I'm a second to third year medic at Peterhouse, and I'll be talking to you about the general preclinical medicine structure, which sort of looks like this in quite overall terms. In year 1 and 2, everybody sort of does the same core subjects, and in year 3, you get to choose one subject of your choice to sort of specialize in. This leads to a BA, and everybody who gets to this stage carries on into clinical school in Cambridge. As Dr. Cook mentioned, it used to be the case that some people would leave Cambridge after about here to either Oxford or London. And you might see some websites saying that as well, but that's no longer the case. Everyone continues in Cambridge. These are the main subjects which you would study in year 1 and year 2. Year 1 is mainly biochemistry, physiology, and anatomy, and year 2 has some stuff which, in a sense, you could view as sort of continuations of what you do in year 1, really. They all have rather odd acronyms, but you don't have to worry about those. Perhaps more important is how the course itself is taught. And this is done in either lectures, there are practicals and lab sessions as well, which would include dissections and prosections for anatomy, which I'll talk a bit more about later. And there are supervisions for all of the subjects. Supervisions are quite a Oxbridge thing. They are small group tutorials with about 2 or 3 people perhaps. And you would have a supervision for roughly every subject each week of term. And these are some of the things which you would come across in biochemistry practicals, just to give you a sort of preview of it, I suppose. Some of these you would have come across in A levels, but you would get to try all of these yourself in year 1. And there's also anatomy dissections. Perhaps just to recap, in year 1, we study anatomy, and in year 2, we study head and neck anatomy. And in year 1, you can probably expect about 4 hours of dissections a week. Part of it would be on cadavers, and part of it would be virtual. So using these large television-like things over here and sort of going through the lesson material. And there are ultrasound sessions as well, where you get to view the structures which you see in the flesh in sort of ultrasound form in actual humans. So that's quite interesting because, for example, if you're looking at a tendon, you can actually see what happens when you move the muscle attached to it on ultrasound, because you're doing it on a living person. There are also applied anatomy sessions. These are, I quite enjoy them actually, because real patients come in with the sort of problems which you learn about in the course, and you get to see what the effect of, let's say, if a patient does not have a functional nerve in the leg. Perhaps they might walk differently, or they might complain of different things. And you get to interact with these real patients perhaps about every month or so. Histology is also quite a big part of the first 2 years. Just to show you what it's like, over here is an adrenal gland in a mouse, and you would learn how to differentiate the different layers and link that to the function of the adrenal glands. And here is a more pathological specimen, which is red blood cells infected by parasites which cause malaria. And there are quite a few things which you learn about this as well. But it's all pretty interesting if you're if you have a sort of scientific inclination. And perhaps what many of you might be wondering is, how is studying medicine in Cambridge different from studying medicine in other universities? And at least for the preclinical side of the course, I've come up with a few things which the Cambridge course does do quite a bit of, and which you might find less of in Cambridge. Firstly, there's quite a lot of teaching about the scientific basis of knowledge in Cambridge. So lecturers often spend quite a lot of time going through the experimental evidence for what we know. And if you are the sort of person who wonders about these things, I think you would enjoy it. There are lots of practical experiments and dissections as well. And there is also quite a bit of essay writing. Almost every exam in preclinical medicine would have essays, and you will do quite a lot of essays as well for homework, for supervisions. Things that Cambridge has less of, I would say patient contact is actually quite little in the preclinical course, although there is a certain amount of this scattered throughout the years. That having been said, if you do value patient contact and you want to have more of that, you can quite easily do it. If you ask doctors or your supervisors, they are generally quite happy to let you visit them in the hospital or in the wards for a couple of days if you want. There's also relatively little what you might call catch-up teaching. This is when lecturers go through stuff which have more or less been taught in A-levels or in IB. And the expectation, I suppose, is that you would know that quite well already. Also, I do want to stress that if you think that you are not having a very good time with one of your subjects at A-levels, you don't have to be too worried about that. Because, well, I did the IB, but I struggled quite a bit with chemistry because of some syllabus issues and because of my teacher, perhaps. But when I came to Cambridge, my supervisors really made sure that I knew whatever I had to know for the course. So don't worry about that. And problem-based learning as well, PBL. This is a relatively new sort of teaching that some universities have adopted. Don't worry if you don't know what it is, but if you do know about it and you think that it suits you and you're looking forward to it, please, well, you should note that there is almost none of it in Cambridge. In the third year, you get to pick a subject to study in a more in-depth fashion. And these are just very briefly some of the things which probably most of the cohort would choose. The stuff over here on the left. And every year, a few people also choose stuff on the right. And you can really choose anything if you want. I know people who are doing law. One of my friends is doing linguistics. So it's really whatever you are interested in. This is just a very general idea of what you would have in an average week. It looks like quite a bit of things, but I want to say that there is really going to be a lot of time for other things as well. And there are so many opportunities in Cambridge, and I'm sure you will have a great time here. And these are a few of the things which you can look forward to as things which you might do other than studying. Thank you very much. Rana will be sharing about the clinical course next.
My name is Rana. So I'm a now 6th year medical student, and I'm going to be telling you about the next 3 years of the degree. So I'll just start by sharing my screen. Okay, so I'll be telling you a little bit about the next 3 years, like Jen said. And basically, you become a student doctor, and it's all about getting used to examining and taking histories from patients. And basically, I'll just be taking you through the kinds of things that you expect. And of course, as always, feel free to leave any questions and we'll make sure to answer them at the end. So this is a bit of a complicated looking slide, but what I want to get to across to you here is just the course structure. Overall, year 4 is more generalized, so it's more about just getting used to seeing patients, taking histories from them, and just kind of getting to grips of being on placement. And then year 5 is more specialized, so you do things like neurology, pediatrics. And being in Addenbrooke's for that is a great advantage, because Addenbrooke's has a whole, is a tertiary center, and it's got lots of specialized neurology going on, lots to see that you wouldn't be able to see in a lot of other places. So Addenbrooke's is the hospital that is in Cambridge, so when you're in Cambridge, you'll be there most of the time, but there's also regional placement, which I'll go on to talk to you about a little bit as well. Overall, there's lots of clinical exposure, and as you can see, it's kind of split into different things, so you get to see a bit of everything. So there's emergency care where you'll be in A&E, there's surgery where you see lots of theatre, you get to be on wards in medicine, and then also things like GP. I'd also like to point out that there's lots of chance for you to kind of explore your interests. So if you see here, there's a SSC or research block, which is student selected component. Lots of universities do this, but this is just a really good chance for you to kind of get involved in something that particularly interests you. So I got to do a really interesting project in public health, which is something I'm really interested in. And you just kind of contact anyone you've met that has some interesting work going on, and you get to kind of get on with that for 5 weeks, which is I think a really good advantage. And also in 5th year, you then get to choose a student selected placement, which means if you're really interested in eye surgery, you can see lots of eye surgery and so on. It's just a really good chance to kind of expand your interests. And then next, I'll talk to you a little bit about the actual biomedical campus. So this is where Addenbrooke's is. It's a huge site. It's got lots of fancy research centers. So you can see that you've got AstraZeneca, which is like a really big pharmaceutical company. There's also a swimming pool and a gym, which you get membership to, which is really, really nice way to kind of relax. And there's a major trauma center, so you can see the helipad there for helicopters, and also the Papworth Hospital, which is an amazing site for heart and lung surgery. So in your 5th year, you also get a week there, and you get to see lots of really interesting surgery. It's really high tech, amazing stuff. It's just you wouldn't get to see in a lot of other places. Still growing, really. Okay, and next I'll talk to you a little bit about a typical day in Cambridge. So when you are in Cambridge, you get teaching on a lot of different things. Usually the teaching is kind of concentrated in what we call review and integration weeks, and that's kind of placed between your placements. So let's say you finish a couple of weeks in GP and then you get an R&I week, and then after that you go on to medicine or something. But you get lots of different things. So you get lectures. So this is the main lecture theatre that we use. It's just kind of like Jen described in 1st year, but it's based in the clinical school, which is on that biomedical site. And basically, the lectures are just about lots of different things. Some things, for example, like ethics, but then also just kind of like how to diagnose kind of what can be associated with a headache, for example, or vomiting and things like that. So just kind of the bread and butter of the course, let's say. And then there's also things that you do in smaller groups, for example, clinical communication skills, where you cover things like breaking bad news, motivational interviewing, and that's done in small groups, just to help you really get used to kind of the more difficult stuff that you'd have to talk about with patients. You also get small groups ethics teaching, and that's just a really good chance to discuss things in a group and kind of debate and so on. And lastly, there's clinical skills practice. So we have clinical skills labs, and there you kind of just learn how to do, for example, take blood, measure blood pressure. It's also we get to lumbar puncture, which is quite an interesting thing that not all clinical schools teach. And yeah, that's quite an advanced skill that we got to learn last year, so in 5th year. So that's really interesting. Next, I'll talk to you about the regional hospitals. So this is a map that shows kind of all the regions that we get sent out to, because obviously it's quite a big course. There's not always a lot of space for us all to be in Edinburgh at the same time. So we get sent to lots of different places. So for example, King's Lynn, Ipswich, Stevenage, Bedford, all of which are really good hospitals. They tend to be a little bit smaller, which means that kind of you get to do a lot more in a way, because it's a smaller team. You get to really know who's on the ward, and it's just a really nice way to get used to taking histories, examining patients. And also some of the areas are really beautiful. So for example, Ipswich, as you can see here, is right on the beach. So we get to go to see after placement, which is really interesting and nice. And it's good because it's just you're in a smaller group, you get to meet lots of new people, and yeah, you're given accommodation there, but you can also go back to Cambridge in the weekends. So it's really nice experience. And you can see there that you can see the seals on the seaside, which is really nice. And then next, I'll tell you a little bit about a typical regional hospital day. So on your regional hospitals, you kind of get slightly less theoretical teaching and lectures, and it's more about being on the wards and just getting used to that, just average day being a student doctor, really. So in the morning, maybe you go to a ward round. So a ward round is just basically where the consultant and the registrar go around, see all their patients. And it's really interesting. It's a great way to learn lots. You know, you get to just understand a bit more about how the patients are being managed and just the day-to-day kind of managing of a ward. And then you can also practice assessing patients. So a really nice thing to do, you just go and ask the nurse, for example, is there any patients I could see? And they just say, oh yeah, so you can go see bed 6 or something. And then you get to go talk to that patient, take a history, to examine them, and then present back to the doctor. It's a great way to learn, because you can, as well as learning to talk to patients, you get to kind of understand how best to present them and how to manage them. And then you can also learn, do some clinical skills. So sometimes you need to take, I don't know, you can take some bloods or measure someone's blood pressure. And yeah, that's another really good way to get involved. And then sometimes if it's a slightly quieter day on the ward, you can do some self-study, just do some reading, kind of brush up on what you saw that day, so that it kind of helps build on what you saw. And yeah, I think it's a really nice kind of less intense way to learn, actually. And then there's also lots of extracurricular activities. So first of all, there's loads of societies. In clinical school, there's lots of academic and specialty-based societies. So for example, ophthalmology society, neurology society. And that kind of gives you a chance to learn a lot more about a specialty you're interested in. And they do talks, and you can learn a lot from them. And also you can host talks and do teaching, which is a really nice way to get involved with clinical school. And then to build onto that as well, because it's a lot less intense than preclinical, there's less of those essays and so on to be doing. You're kind of left to your own accord, which means that you can also explore your interests. I know lots of my friends do projects. You can even get grants to go to conferences abroad. And it's just a really nice way to kind of build on your interests go above and beyond, really. And then also there's sporting societies, for example, rowing and badminton, which is a really nice way to unwind and meet people. And then when you are in Cambridge, for example, in 5th year, you're mostly in Cambridge, you can also get involved with the normal wider university societies. And just still kind of be involved with that in college events and so on. And it's just kind of a really nice way to kind of again meet people, see non-medics, which is quite refreshing. But that's everything from me. Feel free to leave any questions, and of course we'll make sure we answer them. But yeah, thanks.
Hi everyone, I'm Jen again, and I'm recording this after the event to explain a few things which I didn't get to during the event itself. So I'll be talking about the academic year in Cambridge. Then I will say a little bit about exams. And finally, I'll try to explain your third year course options in more detail if you were to do preclinical medicine here. So this is the academic term dates, which I have copied from the university website. There are 3 terms of 8 weeks each, except for the final term, which is slightly shorter. And almost all of the, well, firstly, all of the teaching is done within these 3 terms. And most of the actual teaching, or in terms of lectures and so on, takes place in the first 2 terms, which are known as Michaelmas and Lent. And the third term, Easter, is more for revision as well as exams. Compared to other universities, the terms in Cambridge are generally shorter and the holidays are longer. And this could be beneficial if you are planning to do research or volunteering or working a job in the holidays. About exams, as we said, exams are mainly in the last few weeks of Easter term, and each subject will have a few types of papers. There are MCQs, which you should be quite familiar with, I suppose. There are steeplechases as well. These are in anatomy as well as histology, and it's basically a series of stations with specimens, either sort of cadaveric specimens or specimens of histology slides, and you view each specimen and answer questions about them. There are practical papers as well, which are, well, you don't have to do the experiments yourself, but they give you the data and you have to know how to handle it and interpret it. And of course, there are also essays. That's about all I wanted to talk about for exams, just to sort of give you an idea of how you are tested. Now about third year subject options. This is a slide which I showed you earlier, and generally people would do these things over here, especially physiology, pathology, and pharmacology are usually quite popular with medics. But these are the subjects which you can do. There are also 2 sort of ways in which you can structure the course for the third year. And it's quite complex, but I'll try to explain it here. The details are in words as well. Basically, if you could choose to do a single subject, one of these things over here, or genetics or biochemistry, and you do a research project in it. And that's probably the most straightforward option. You can also choose to do 2 subjects, in which case you choose 1 major subject, which would be similarly any of these over here, and 1 minor subject, which is from a list which includes these options over here. And minor subjects usually have a lot less hours than major subjects. But the big difference here is that instead of doing a research project, which you would do if you only studied 1 subject, if you are taking 2 subjects, you write a dissertation in either of these subjects. So the allocation of your subject choices is competitive. So everybody is ranked based on their first and second year performance, and going down the list, people get their top option. But generally, most people do get something quite close to what they want to do, especially because there's also an appeals process, which takes into account your interest in the subject which you want to study. So that's all I have. Thank you very much, and all the best with your applications.